Hello everyone, I'm Dr. Sanjay Murthy, a gastroenterologist at the Ottawa Hospital. Today, I want to talk to you about inflammatory bowel disease, also known as IBD. This is an important topic because it affects close to 1% of the Canadian population and can lead to serious health complications if left untreated. Let's begin by defining what is inflammatory bowel disease. Inflammatory bowel disease is a spectrum of disorders characterized by chronic inflammation of the intestines and sometimes other organs. IBD includes two main subtypes, Crohn's disease and ulcerative colitis. Both conditions have overlapping signs and symptoms, including abdominal pain, diarrhea, weight loss, and anemia. Crohn's disease can involve the entire gastrointestinal tract, from the mouth all the way down to the rectum, although it primarily involves the distal small bowel and colon. Crohn's disease can also lead to complications, such as intestinal strictures, fistulas, and abscesses. Abdominal pain can be a prominent symptom of Crohn's disease. Ulcerative colitis is a disease of the colon and rectum, typically involving the inner layers of the colon and rectum, and gives rise to characteristic symptoms of bloody diarrhea, rectal urgency, frequent stools, and sometimes feelings of incomplete evacuation. Severe ulcerative colitis can be complicated by toxic megacolon and bowel perforation. While the cause of IBD is still being worked out, it is thought to be caused by a combination of genetic predisposition, environmental factors, and the gut microbiome. Risk factors may include a family history of IBD, cigarette smoking, and certain medications. There is currently no test available to predict whether somebody will develop IBD in their lifetime. Importantly, IBD is a very different condition than IBS, which stands for irritable bowel syndrome. IBS is typically associated with similar symptoms of abdominal pain and altered bowel habits, but rarely causes rectal bleeding, weight loss, anemia, or other complications. There is currently no cure for IBD, and the vast majority of individuals with this condition will require lifelong medical treatment targeted at treating inflammation of the bowels. At the same time, with appropriate treatment, IBD can be well controlled and permit a good quality of life in most individuals. The diagnosis of IBD requires characteristic changes on endoscopy, either colonoscopy or gastroscopy or both, along with biopsies of the lining demonstrating microscopic changes that are compatible with this diagnosis. In addition, your physician will likely order blood work and stool tests and possibly a CT scan or MRI to help better characterize the severity, location, and extent of the illness. Thereafter, these tests may be performed at varying intervals to monitor disease behavior and to assess the impact of prescribed treatments on the disease. Treatments for inflammatory bowel disease focus on controlling inflammation, which, in turn, should relieve symptoms, prevent complications, and lead to a good quality of life. The ultimate goal of treatment is to completely heal the bowel and eliminate troublesome symptoms. Medical treatments can include pills, self-injection drugs, or intravenous drugs. In some cases, surgery may be required to manage the disease or treat its complications. There is also growing interest in the use of dietary changes as well as complementary and alternative medicines to assist in controlling the disease. In conclusion, our discussion on inflammatory bowel disease highlights the importance of awareness and proactive management. By staying informed and seeking appropriate care with a licensed health professional trained in managing IBD, we can work towards better bowel health and overall well-being. This is Dr. Sanjay Murthy, and I hope this information is helpful to you.